So this is John Barry, who's the co-founder of the male psychology section of the British Psychology Society, and he's also one of the co-authors of Perspectives in Male Psychology. This book is so comprehensive, it's almost a handbook for our APPG. And John is going to talk about the role of male psychology in guiding a men's health strategy to give positive outcomes for men's mental health, because you may remember that in our Boy Today project, we identified that misunderstandings about male psychology were behind some of the failures of policy to address men's issues. Thank you, John.
Right. Thanks very much, Mike, and thank you for inviting me here today. I'm very proud to be part of this whole process. I think it's very interesting, got great potential. I'm going to start. Am I sharing the slides okay here, Mike?
Yes, you are. Yeah.
Right. I'm going to start off with a quick overview of what I'm going to talk about today. I'm going to mention a little bit about the evidence base for this type of topic, then looking at some of the hurdles that men face regarding health, which often don't get talked about, solutions to the problems that we're faced with in terms of men's health. And then I'm going to mention a bit about masculinity. It's a topic that's been in the background of a few of the talks so far, but it's not really being fully addressed yet. And then I'm going to mention something about my opinion on the ways forward. So again, some of the previous speakers at the APPG have mentioned and in fact described very clearly a lot of the health inequalities. So we've got various cancers that are more represented in men, heart disease, substance abuse, physical and mental health issues, in some cases are more represented in men. And of course, suicide is a big issue. But what are we going to do about these health inequalities once we've identified them? That's the big question. So one thing we've got to do is really base our health strategy on good evidence. And we have, my master's degree was in health psychology, and I learned a lot about different models of health behavior. And I also learned a lot about how lots of them don't work. So there's a recent review on the topic has found that conventional health behavior interventions based on a lot of the usual health behavior models have typically produced only small-sized effects. In other words, that they're not particularly useful. And so there's been recently this idea that masculinity might be some sort of barrier or impediment to men achieving optimum help or seeking help for their health issues. And this is usually based around the idea that men tend to take more risks than women do. But if you look at the research on this, actually this information about men taking more risks isn't that useful, because it's quite actually hard to get men to change their assessments of their risk and change their behavior accordingly. And in fact, some cases you can produce the opposite effect by highlighting risks to men. So there's also this idea about men needing to repress their emotions, so they can't seek help because it makes them look weak. I mean, there is lots of research that seems to find this, but if you look at the research, a lot of it is based on quite young samples. So it's college-age men and people who are known, actually, like young men are kind of known to be quite risk takers, and you know, they're not a very good representation of what a more mature man is like. And sometimes you hear the criticism that men are too stoical to seek help in terms of their mental health and physical health. In fact, stoicism is the cornerstone of one of the most successful models of therapy called rational motive behavior therapy. And in other words, I mean, if men were actually truly stoical, I mean, it would solve a huge number of mental health problems quite quickly, I think. So one thing that we don't get to talk about very much then, because we focus a lot on other issues, is some of the hurdles that men face in terms of doing something positive about their mental health or their physical health issues. And so having a look at the literature, we've come up with these 5 different hurdles, often called barriers, but I think hurdles is a better term, because most of these issues are you know, you can overcome them if approached in the right way. So the first hurdle is not thinking that the person needs help. Now, for a lot of men, some of the issues that they'll be facing are ones that they genuinely won't recognize as problems for them. So, for example, prostate cancer sometimes is asymptomatic. So I think a lot of men don't even notice there's any signs at all that they should be concerned about, so they don't seek help. So it's a bit unfair to blame them for not seeking help when they really didn't see a reason to. Another issue that's often overlooked is the fact that about 8% of men are colorblind, and it's about 16 times more colorblind men than women, as it happens. And this means that with some symptoms of health problems, you're not going to get any of the warning signs. So if you're colorblind and you can't see the difference between red, green, and brown, say, you won't be able to tell if you've got blood in your feces, which is quite an important symptom to notice, or things like jaundice or skin discolorations. A lot of these things are invisible to men. So again, men won't be seeking help for these issues if they can't see them. So the second type of barrier we identified is being ashamed to seek help. This isn't particularly a male specific problem. Men and women feel shame and stigma to about the same degree. So I won't say too much about that one. Distrust of therapists is the next hurdle. And by the way, these different hurdles are in roughly chronological order of somebody's decision to take action for their health, roughly speaking. So this hurdle about distrusting therapists, I mean, this is something that's recognized a lot in the medical field. Men, for whatever reason, don't feel as comfortable talking to health professionals. And especially there's sometimes a perception that they're being talked down to and they're not being really respected by health professionals, which is an important issue. So if you feel like that about the person who you're supposed to seek help from, that's quite a bit of a problem. And we have some of the same issues, in fact, more and more in terms of men seeking help from psychological therapists, unfortunately. The next hurdle then is other people will find out. And once again, this is the type of hurdle that is roughly the same for men and women. Men and women both find it very important that they, whatever help seeking they engage in, that it will be confidential. And so there's not really a sex difference there. In terms of concrete barriers, as I describe them here, there are sometimes, and it depends, in countries with free healthcare, it's a bit different, or easy accessible healthcare. But for some people, not being able to afford proper healthcare is a barrier. And for men especially, not being able to take time off work or feeling that they can't because they might be seen as malingering, that could be a barrier to them actually seeking help. So we have these various types of hurdles to men seeking help, which unfortunately are often overlooked in the I think focusing on masculinity these days. Now, if we do look at these issues a bit more closely, we can do some quite interesting thinking. I think we have to get a bit creative about how we look at these issues, because these are all quite complex. I mean, they're not kind of simple problems, and they don't have simple solutions, but they do have potential solutions, but we tend not to even look at them very clearly. So what we have here on the right is an ecological model of male psychology, and it shows that you can look at any man's problem on various different levels. So we can look at things from the individual level, and that might involve looking at masculinity. It might also involve looking at things like age, which are very relevant in terms of men's health behaviors, because younger men take much more risks. Younger men feel a bit more invincible than once you hit about 30, then you start being a bit more realistic. Also, on an individual level, trauma is quite an important topic that's overlooked. A lot of men's problematic behavior, including problematic health behaviors, can be traced back to trauma. A well-known example is post-traumatic stress disorder, and we have combat veterans who often will end up having substance abuse problems and things like that because of their trauma, and it's not to do with anything else really. It's really traceable back to traumatic events that have basically harmed them. We can also look at things on a different level. So if we look at the interpersonal level, relationships are very important, for men, and having stable relationships are very important to men's well-being. When the relationships break down, this can be really catastrophic for lots of men, and there are other issues around processes around breakdown that can also be very damaging to men. And social isolation, which again is related to relationship breakdown, these can all have a serious impact on men's health and men's help-seeking behavior. There are, at the community level, some quite good programs that I'm going to mention in a couple of more slides. And then we can look at other things too. So the media is sometimes criticized as presenting men in a problematic way. And I think if we had maybe some more useful representations, more accurate representations of men and male typical behavior, we might find men responding a bit more to efforts to reach out to them, to get them to do behaviors that we think are good for them. And there's a kind of really cornerstone issue these days about masculinity, because we have the view often presented that masculinity is a barrier to health behavior, but there is also some research out there that suggests that masculinity can actually be helpful in terms of health behavior. But we tend to have what's been described as a paradigm fixation on negative views of men. So we tend to kind of view masculinity as being a negative type of thing. Very often about competition and kind of struggle to have power over others and control over other people. There's a whole, there's just a huge research effort that seems to kind of go down that pathway. And I think we need to step back and see, well, hang on a second, is this realistic? And in fact, is it maybe quite wrong in missing the fact that masculinity can be quite useful in terms of helping them with their health. There's another issue about this too, which is that the general public tends to dislike terms like toxic masculinity. I mean, they tend to feel insulted. In fact, I did a survey which found that about 85% of men and women found the term toxic masculinity was insulting. And also they were worried about the harm that it might cause to boys by being exposed to this sort of narrative about themselves, in effect. So I think we have to be very careful about using a concept of masculinity that's negative when we might better use a more positive concept of masculinity. And so there is evidence, as I said, that masculinity can be harnessed to encourage healthy behavior. And there is evidence out there that's found this. And I'm just going to mention something from Martin Seeger, who presented to the APBG a couple of months ago. And his concept of masculinity involves the idea that men have this evolved script to be a fighter and a winner, a provider and a protector to their family, and to be in control of their emotions. And the idea is that this is based on evolutionary forces. So can these things be used positively? Well, yes. I mean, and in fact, there are studies out there that show that this type of thinking can actually be applied in a useful way in terms of health behaviors. So help seeking can be considered as finding an ally to fight against poor health. So this fighter and a winner idea can be used in a positive way. Looking after your health means being better able to look after your family. There we go. We've got the provider role being used here in an effective way to help men to take care of their health. Overcoming fears about stigma means being brave and controlling one's feelings in terms of maybe seeking interventions that might be quite distressing or uncomfortable. And again, controlling your emotions can be quite a useful thing in this sort of process. And I think we've tended to miss this in a way quite obvious trick here of being able to reframe what is often seen as negative things as being positive things. So there is the other issue too about physical health. There is a lot of evidence that men and women whose mental health is better tend to take more care of their physical health too. So there's a great deal of evidence, and actually it makes perfect sense. It can work the other way too. I mean, if your physical health is deteriorating, that can be bad for your mental health too. But it's definitely a two-way street. And there is, and I think that's important, there have been people who have looked into how do we help men with their mental health, and they've developed different programs, and have got a synopsis of some lessons from Professor John Olaf, who's been an expert in this and lots of experience. And a few of these are just worth noting in relation to our efforts here today too. Well, if we take lessons of formal evaluation of the program is critically important. And this is, I think we have to really work from a solid evidence base. We have to and I think check the different possibilities, the different ways that we might be able to help men with their mental health. If there's things that we've been doing in the past that haven't really worked that well, we should consider other options. And it might be that the other options aren't that brilliant either, but we should definitely consider them because at the moment we have these massive health inequalities that aren't really going away. If we look at lesson 3 here, the respect the right to silence or to talk. I think we often think that in order to benefit in any type of mental health context, men have to talk about their feelings, and that may definitely help a lot of men, but it just so happens that a lot of men get put off the idea of going somewhere to talk about their feelings, even if they know it might do them a lot of good. So I think we have to be a bit more clever about how we present various programs, and we should always be very hesitant about presenting things being about even positive concepts of masculinity. Men tend not to want to talk about masculinity. They definitely don't want to hear about negative aspects of masculinity. So these are all things that we really, I think, should value. Any previous research we should be really looking at closely. So just to summarize then and conclude, we need to identify the causes of health problems in order to be able to fix them. And we need to be able to recognize the different problems, including the various hurdles that men face. And if we don't do that, we're inclined to do what's often described as victim blaming. We tend to think, well, this man's not seeking help for his problem. He obviously has got a kind of a mental health or physical health issues. He's not sought help for them. It's his own fault. I think we just have to be a bit more compassionate and a bit more clever and think about ways that we might be able to reach out to those men rather than write them off. So we need to be creative in identifying solutions. We need to break out of this paradigm fixation of looking at negative aspects of masculinity, and look at the different ways that we could help men, the different avenues of doing so. We can quite possibly harness masculinity in beneficial ways. And it should be noticed that improving men's health and the health of boys is going to be a positive thing for everybody in all sorts of ways. If we improve mental health, we're reducing difficult behaviors, reduce physical health problems. You know, we're reducing massive costs to the system. So I think there's all sorts of good reasons why we should be really sitting down, taking a very long, close look and doing some proper research on the ways that we can help men with their health problems, including mental health problems. Thank you.